Okay, in this video, I'm going to talk a little bit about the cost of long-term care and how that will then relate to long-term care insurance and so forth. So, the cost of long-term care is likely going to be thousands of dollars per month. It will vary to some extent based upon the type of long-term care that's needed, and that'll be discussed a little bit in the subsequent subpoint here. But generally, we're probably looking at thousands of dollars per month, most likely. And that can be broken up into kind of a couple of different categories, if you will. You can have room rates for facilities in which a person is receiving long-term care at a facility. And so you're basically paying for a room. So uh, within that, there's sort of a spectrum, and that is assisted living facilities are generally the lower end of the cost spectrum. And that's basically going to be the type of facility where there's some assistance that's available to help with things, but um, not necessarily assistance for every task. A pretty fair amount of independence is still being assumed there. It's just there's going to be somebody on site who can assist with certain things um, from time to time. At the other end of this cost spectrum, in terms of room rates, is basically going to be a private room at a nursing home. And that's going to be the more expensive end of the spectrum. Generally, at that point, the assumption is there's a lot more care going on. Um, a lot more difficulty is being encountered by the people in the long-term care facility, in engaging in their daily activities. Oftentimes, you wind up with people experiencing some levels of dementia or things like that uh, by the time you get to a nursing home kind of facility. Not always. Sometimes there are other kinds of things that would cause that, but that's typically a little bit more the level of care that's typically involved is much more extensive there. Now, that also relates to just the assistance rate. So if we're just looking at assistance, we don't actually have a situation in which a person is staying at a facility, then there's sort of a spectrum for assistance rates as well. So adult day services is going to be the lower end of the cost per month, and basically the idea is you're getting some services during the day, not necessarily all the time, not necessarily all that extensive, but some services. And then you get to the homemaker companion area, and that's where somebody is actually staying in the home a significant portion of the day, helping out with a lot more of the day-to-day kinds of things, hence the homemaker idea, companion. So a lot more activity and involvement. That's going to get definitely significantly more expensive per month. And then you get to the higher end of the cost per month for assistance rates, and that's going to be the home health aides. And if you think about what a home health aide is going to be doing, which is helping with medical issues specifically, maybe helping with administering medication, or the person has a significant medical condition that anybody who's helping them has to have training for. This is obviously going to be a much more expensive end of the spectrum typically. And so generally speaking, if you just think about the cost of long-term care, whether it's in a facility and room rental rates and the associated help with those, which is going to be on a spectrum depending on just how much help is involved. And then you get to kind of the even just assistance rates, which would generally be more focusing on the person is receiving long-term care, but perhaps in their own home. And there's a pretty good spectrum there, but generally we're looking at pretty expensive options overall. So generally, as an assumption, the cost of long-term care on an annual basis is going to be pretty hefty, probably. But it can range pretty widely depending upon what kind of care and what kind of facility the care is being given. Hopefully this video is helpful. Thank you so much for watching and have a great day.